My name is Deke Cateau. As I was introduced, I'm the CEO of AG Rhodes, and unashamedly, I am a nursing home guy, a nursing home provider. I love nursing homes. I think they are such an important part of our fabric, socially, of our fabric as a sector, as our fabric as an industry. And I'm just so proud and overwhelmed to be here. This is my first in-person Pioneer Conference. So I want to so thank Penny for this. I got in yesterday from a retreat, came straight here, and this has been such an experience. I've heard about it, but it's been such an experience for me. So Penny, thank you. I would love us to stand and give Penny a round of applause for what she does. And I'll again say unashamedly, she's done a lot to help me. She's done a lot to guide me. She's done a lot to inspire me when I've been down. And these are one of the times that I'm down, and we'll hear about that later. So thank you, Penny. Also want to thank Joan and ask you all to do the same thing, and let's stand for Joan. So you all see we're going to be sitting, standing quite a bit. So Joan is being honored by McKnight's as a woman of distinction. When I hear these things, I'm like, she's always been a woman of distinction. And we've known that for a long, long time. So thank you, Joan. So I'm overwhelmed. I'm taken aback. Two of the people that really started me in this movement, if you want to call it that, Walter Coffey, Kim McRae, who are here, David, so many others. And I wrote a book about a year and a half ago. And in really researching this movement that I was part of, I read about the Bill Birkins, and I knew Rosemary, and I knew some of the others. But this conference so far has really brought that home. And these individuals on this front table here, again, Mr. Merkin, hadn't met you yet, but thank you. All of y'all, to quote you, Bill, you put your whole selves into this. You took your whole selves out. You put your whole selves in. And what did they do? They shook it all about. You made this movement, culture change, which is written into the regulations now that no one takes seriously, right? But they wrote it in because of you guys. So thank you for doing the hokey pokey with this. In 2013, I was actually then the administrator of one of our homes, and our CEO, Al Blackwelder, who still remains a close friend and mentor, called me. Emory University Hospital, huge worldwide hospital system, huge hospital system, was discontinuing two of their programs at their geriatric hospital, the music therapy program and their horticulture therapy program. He called me. He used to call me to run things by me. And he said, Deke, Emory's getting rid of these programs, and I'm about to take them over. We are a small three nursing home group out of Atlanta, which I'll describe later. So I'm like, are you crazy? Emory can't afford the program. We're going to take it over. A year later, I called Al, and I said, and I still say today, these were the two most transformative programs. I know we hate to use that word, but I'm going to talk real to you all today. These are the two most transformative programs that I have seen in nursing homes. When COVID hit, we, like every nursing home in this country, had to close our doors to everyone. We're still vilified for doing that, like it was our fault for doing that. We had to. The law came down on us on March, I think the 10th, 2020. We have to close our doors. Those two programs morphed, and those two programs really kept our residents vibrant even during COVID. And last year, when we were able to reopen our doors and welcome folks back to our nursing homes, it was such a proud feeling, like it is today for Penny and for others, to welcome folks back. I want to show you all a quick video of that. We are finally here, but now I want you all to show our welcome back video. 20, we were forced to shut our homes down. We shut it down to families, we shut it down to friends, we shut it down to visitors and to volunteers. But now things are a bit better, so we are excited to welcome you back to our homes. Welcome back.
Welcome back. The pandemic kept you out. Welcome back. That same old place that you thought about. Well, some faces have changed since you hung around, but the dreams have remained and they turned around. Who would have thought they'd lead you back here where we need you? Yeah, we missed you a lot, 'cause you got it on the spot. Welcome back, welcome back, welcome back, welcome back. Welcome back, welcome back, welcome back.
Welcome back to our homes. Again, I thought Al Blackwelder was crazy keeping these programs. What John and Kirk, who leads our horticulture therapy program, and I will say program, do, they bring life. They bring life back into our elders. They bring life back into our residents that we thought were gone. You know, they morphed during COVID. They went virtual onto televisions in residence rooms. They went door to door, playing music, doing horticulture therapy, planting stuff, but they brought life during COVID back to our residents. So I'm not going to let John get off the hook, because we came a long way, so he's not going to just come to sing one song. So think of something else, John. Let's get these. Yeah.
and spring became the summer. Who'd have believed you'd come along? Hands, yeah, touching hands, reaching out, touching me, touching you. Sing it, sweet Caroline. Good times never seem so good. Woo! I've been inclined to believe they never would. Oh, now I look at the night and it don't seem so lonely. We fill it up with only two. And when I hurt runs off my shoulder, how can I hurt when holding you? One, touching one, reaching out, touching me, touching you. Sweet Caroline, good times never seem so good. I've been inclined to believe they never would. One more time. Sweet Caroline, good times never seem so good. I've been inclined to believe they never would. Sweet Caroline. Oh. Woo, thank you.
Penny, do I have time to speak? So that, I don't know about you guys' nursing homes. That's what happens in my nursing homes. Every day. And there are people in here that could testify to that. So again, real quickly, my name is Deke Cateau. I am the CEO, proud CEO of AG Rhodes. I'm going to talk a little bit about AG Rhodes. How much time do I have, Penny? All right. Yeah, just tell me when I need to wrap it up. I'm going to talk a little bit about my organization because I think it is so emblematic, so symbolic of what our industry represents. We started in 1904 as the Home for the Incurables. That was our name. We were one of the first registered, I think it's the first registered nursing homes in the state of Georgia. We are one of the oldest nonprofits in the state of Georgia to this day. We've morphed from that one home to now having 3 homes, capacity of about 418 residents at any one time. We serve about 1,500 residents each year. Very, very important. Remember, we're remembering the past, honoring the present, the future. So understand this. We started as the Home for Incurables. That's where nursing homes came from. Don't blame the nursing home for that, right? Nursing homes, even now, exist in a certain space and time based on where we are as a society, as a community. This picture here, our AG Rhodes Carb community, which we are rebuilding, broke ground a few weeks ago, $37.5 million project. I don't know how we're going to pay for it yet. But the bank gave us a loan. But that's where we're going. Fully private rooms, households, as we know, which is so important. That's where we're going. And more important than that bricks and mortar is the type of care that we're going to give in that. People like John, people like Kirk, the type of care we're going to give in it. Bold statement. It's time to invest in our physical properties, or it's time to leave this business. It's my prediction. We are going to have a reduction of inventory. Nursing homes aren't going anywhere, folks. I know a lot of people say they're going to disappear. Nursing homes can't disappear. We know why they can't disappear. There's going to be a reduction of inventory. I think the best of the best will remain. Those people in this room who are committed to it, who have worked off the backs of what these folks at this table and all of you folks in here have done, are going to remain. And we're going to remain, and we're going to be strong after because of that. Not just because of the physical property, again, because of everything else that happens, because of culture change, because of person-directed, person-centered care. Call it whatever you want to call it. Forget the words. I'm pretty new at this. I tell folks I'm a recovering institutionalist. Right? I still drop F-bombs. Kim, where's Kim? Kim, I drop F-bombs all the time. Right? You all know what F-bombs are? Absolutely, yeah. It is what it is. Was very fortunate to have written this book about a year and a half ago. This book came out of many things. It's my personal expression of our industry. For years I said, any one of us that work in this industry for years, or in this sector, for years I've said we could write a book about the things we've seen. COVID gave me the opportunity to be able to do that. Gave me the opportunity for two reasons. One, it was an extremely tough, depressing time for me, seeing what my staff had been and continue to go through. I would not sleep at night. I could not sleep at night. That's when I started writing. It was either that or become an alcoholic. Because I was up in the night, trying to go to sleep with cab, which I still love a good cab, by the way. But it also was my way of giving back to my staff, documenting what we have been through, we're not over with it yet. Documenting that for them to understand and for them to read later on and understand the important contributions that they have given to this. And we're going to talk a lot about that because I think we don't understand what they have given, and we don't understand how close we are to losing them because we don't respect them, because we don't take care of them, and because we don't show them what they really mean to us. So this book, Brushfire, is dedicated to them. I don't make a dime from the book. It's doing pretty well. Every dime from this book goes to our frontline staff, to my staff's education fund. We're putting people through school, helping them to get further in their careers, to get further in life. Most, if not all of you here are going to get a free copy today or tomorrow. Penny has copies of it. But please still go on Amazon and purchase one. Because again, it's not for me. It's for them. Purchase one and gift one. Because we need to get this message outside of the choir, right? This is the choir here. So everything I tell you guys today, you're going to be shaking your heads. Because I'm preaching to the? Absolutely. The other thing I'm going to touch on is this very, very important report that I know a lot of you know came out recently. National Academies of Sciences and Engineering. Huge report, 600 pages. Any of us in this room could have written this report like real easily, right? Yeah. For me, great report. Nothing was earth-shaking in it for me. Nothing. But I'm glad it's put all these things on the focus, on the public focus. I ask you as we understand this report, do not vilify the nursing homes because of this. I know there are very horrible nursing homes in this country, very horrible. I've seen some, I've worked in some, very horrible. I honestly believe that most nursing homes in this country are trying to do the right thing within a very broken system. So they don't even know what they're doing because they're working within a system that's broken. So don't vilify the nursing homes. Other slight problem I have with this. This is the committee that put this report together. Great people, great people, great intellectuals, professors, scholars, really intelligent people. I work in nursing homes. In nursing homes, literally in nursing homes. I was a nursing home administrator. I'm the CEO of a nursing home organization now, and I'm still almost half the week literally in nursing homes. None of these people are. None of them are providers. None of them are in nursing homes. Houston, that's a problem. For us to fix these things, we need people who actually are in or have been in nursing homes. Show of hands, who's been in nursing homes, worked in nursing homes? Love it, right? For us to fix this, this is who we need to fix this. Not the academics, not the scholars. Now, they're important, and they've put the focus on this. But for us to really fix it now, we need to be the ones involved in that. This is nursing homes. A friend of mine who's an attorney, Jason Bring, who defends nursing homes, actually, I asked him to put this together. It's in my book. I asked him to put together the regulatory bodies that touch on nursing homes. And this is true. This is real life. This is the problem here. That's the nursing home. Every one of these bodies we report to. Those of us who worked through COVID see the problem with this, right? NHSN, CMS, CDC, Departments of Public Health, every one of them having a different requirement for the same thing. And what does it do with us? We start a short circuit. Yeah, this is crazy. This is a web, but it's the reality. True story. John works for me, so he knows it. Few people who live in Georgia know it. Proud to run one of the best nursing homes, absolutely in the state of Georgia, probably in the country. In our Cobb community, the one that we're rebuilding. That Cobb community, right now, as in the last few weeks, is sitting on 3 immediate jeopardy tags. While I speak to you now, the fines keep racking up, hundreds of thousands of dollars. This is a nursing home any of you all will want to put your mother in right now. I'm going to explain why that happened and why it's so wrong and why I'm so passionate about this. And literally when I talk about this, because it's my reputation too, I want to cry sometimes talking about it because it's so, so wrong. So this has been my June. May 16th, a federally contracted team of 5 surveyors from the state of Colorado walk into that nursing home for their annual survey. This nursing home in the last 6 years has gotten 1 citation in 6 years. We are perennially deficiency free. We eat surveys up and spit it out. It's like what we do. We're good at that. They came in with an axe to grind. One was driving a rented red Mercedes-Benz. Just talking the truth. The day after, remember we have 3 small facilities. F-word, F-bomb, but I'll say it. 3 small facilities, communities, call it what you want. The next day, our Wesley Woods community, I get a call. Dude, state's here, right? We're a small building. We don't have the corporate support or capacity, right, to juggle like that. So they walk into another one of our communities, same time. They're there for annual survey too. Okay. Day after, the 18th, I'm driving to the office. I get a call. Hey, OSHA just walked into our Atlanta community on a survey. I'm like, are they trying to get me? I cried in my car. I called my wife. She said, this is what happens. You wrote a book, you this. I'm like, this ain't got nothing to do with me writing a book. This is a broken system. Again, we don't have the corporate capacity. So the team asked me, they decide, hey, can you go to Atlanta? Because I used to run that building. Can you go help them out with this OSHA survey? OSHA comes in, they say nothing for most of the day. They're here because they're investigating. We had they didn't even tell us what it was. We figured out after. They came in because we had an employee debt due to COVID. We reported on NHSN that we had an employee debt, which we did. But we did not report that to OSHA, which you're required to report any employee debt to OSHA. That happens from a job-related injury. Guess why we didn't report it to OSHA? Person didn't get COVID at that building. We didn't have any cases of COVID in that building. The person was home with their child. The child worked at Walmart. Person texted us, hey, my son came home with COVID. I got COVID. I'm going to the hospital. We heard from them a few days later, and I don't want to demean this conversation because this person actually was a co-worker of mine and a friend, someone I knew well. She succumbed to COVID. She passed. It's not job-related. We didn't even have COVID cases in that home, so we didn't report it. OSHA came into our building, spent a full day, took up our resources for that, to figure that out at the end. That's why. One arm of the government is not talking to the other arm, the government. Of course, we reported it on NHSN because we're required to report it there. We didn't report it to OSHA because we're not required to report it there. Couldn't they have figured that out on the telephone? All right, 519, survey team leaves our Wesley Woods community. They have a great survey. 525, the survey team leaves our Cobb community after 10 days of being there. I go in there on day 5. That's when they tell us, well, we're still here because you guys have IJs. I'll show you all what these IJs are for after, right? Moving on, 6-6. This is after they left. We had another surveyor come in to clean up the IJs. 6-8, that surveyor left the Cobb building. 6-13, the Wesley Woods team that just had a great survey, they send the feds in. Go in and make sure that was really a good survey. They stay for 2 days to make sure that they did a good job, and then they say, yeah, they did do a good job. Right? There's government resources there. 6:15, they left, so they stayed for 2 days. Same 6:15, our Atlanta community, 12 surveyors came in for their annual survey. 12 surveyors. Think of the impact of this on a small organization like us that's trying to do the right thing. I was there. This is what that felt like. This is what that felt like. They came in, they didn't enter with anyone, fanned out, right? When I got there again, because the staff is scared now, what the heck is going on? When I got there, I asked, something had happened. What's going wrong here? They explained it was a really logical reason. They had some of their senior people, and they wanted to use this building to let them see what a survey really is like and whatever, so they're going to be here for the 5. Yeah, wouldn't it be nice to let the staff know that, right? A building actually ended up having a great survey, three very minor paper deficiencies. We have a broken system. It is punitive, and it's wrong. So this is our Cobb building. This is John. You all remember John? Right? Immediate jeopardy. This is literally from the surveyor citations, 24 statement of deficiencies, literally. Observations on 5/18/2022. John's here, I'm not lying, this is the truth. This is their words. At 12:43 p.m. revealed 17 residents, 5 staff gathered in the library for music therapy, sitting 6 to 12 inches apart, like you guys here, by the way. within arm's reach. Staff were wearing N95 masks. They were wearing the right masks, but no eye protection. Residents were wearing masks, but they had to be assisted multiple times to place them properly. Number 4, observation on 5/18/11:37 a.m. Revealed 2 sets of visitors. Visitors, you're visiting your family, with residents sitting out in the gazebo table areas, not social distancing, and were not wearing masks appropriately. An IJ is a situation which the provider's non-compliance with one or more requirements of participation, ROPs, is likely to cause serious injury, harm, impairment, or death to a resident. At that time, that building had 3 resident cases of COVID. This is recently, right, with huge outbreaks in our community. 3 resident cases of COVID. No deaths at that time, still didn't. Today, they have no cases of COVID. Right? Tell me what actual harm has been caused. Tell me what risk of death were caused by these situations. So when we shut our nursing homes down and everyone was like, the nursing homes are wrong and everyone's get it, you know what? My staff was right to shut it down in the sense that if this is the repercussion, oh my gosh. Now we're fighting this legally, right? We're up to like $170,000 in fines, denial of admissions, and all of that. We're fighting this, right? May win, may lose. But the reality is, should we be dealing with this? Yeah. So I put this in deliberately. Don't get me wrong. I believe that we deal with the most vulnerable of populations in nursing homes. So it's important for us to be careful. I truly believe in this Mahatma Gandhi statement. True measure of any society is how you treat your most vulnerable. Your elders, your children, your most at risk. I believe that. But I think we've gone overboard. Nursing homes are the only business sector, the only model of business, only one in this country that is still required to have the level of testing that we're doing, the level of vigilance that we're the only one. Hospitals are not. We're testing staff twice a week. We're tired. We're drained. Hospitals do no staff testing. When I bring that up to folks, they say, well, you're dealing with the most vulnerable. Where do they come from? Where do most of our patients come from? So something is wrong. It's wrong. It's wrong. It's wrong. It's wrong. It's wrong. We are being vilified because we are low-lying fruit. Right? We are like that criminal who, you know he was a shoplifter, right? So something's gone missing here. He's easy for us to go after. I saw Jill earlier. I know this is Jill's baby. Jill could teach this for hours. Nothing's wrong with the regulations. I believe nursing homes need to be regulated. I believe they need to be highly regulated. Also believe assisted living should be regulated, by the way. What I do not believe in is the punitive nature of the repercussions of those regulations. Right? Regulations are good, which is why nuclear plants are regulated. Right? Mind you, all regulations are close to those, right, in nursing homes. I think when NASA heard it was like the 3rd highest. It was the nuclear, then it was the aeronautical industry, then nursing homes. Right? Regulations are good, but this idea of surplus of safety is an issue. If we want people to live, if we want people to be able to live and live their life at the fullest, we cannot walk on an eggshell with that. A long-term care ombudsman early in my career told me people have the right to make a wrong decision. Right? We got to be really careful how we walk that tightrope with regulating this safety aspect. Jill writes about it in her book. This idea of surplus of safety we've taken overboard. So we're afraid to let people live. So we lock people up in nursing homes, in rooms, because we're afraid to let them live. We're afraid to let them come to music therapy. And when we do, and they step into that 6 feet, you know, We're going to talk a bit about COVID. We're going to talk a bit about crisis. This is ultimately a statement I truly believe in, and I believe this about our industry, which is why I said we're going to have a reduction of inventory. I think crises do destroy bad companies, and I think good companies survive them, and great companies get better by them. So I am at my lowest professionally. I've shared that with some people in this room. But I do believe myself, I believe my organization is going to end up even greater because of this. As long as we could afford to get through it with the fines, we're going to end up even better. So COVID was a really, really, really difficult time for those of you who do not work in nursing homes. The young lady in the corner, Natisha Harden, that's my friend who passed away. She was my age, 3 kids just like me. Passed away from COVID. That was hard. That was hard for staff to deal with. That was hard for her residents, who she took care of. She was a nurse to deal with. Very, very difficult. This picture in the top right-hand corner, we talk about surplus of safety. That was our COVID protocols back in 2020. I got a call on March the 11th, 2021 from a family, the Immerman family, and they called me on my cell phone. I'm like, how did you get my cell phone number? They were obviously very resourceful to do that. And they said, well, we're calling you because we heard you're a good man and we heard you listen to us, and we want to come to the nursing home to visit our mom tomorrow. With the guy's mom tomorrow. And we just heard that there was a release or relaxation in the penalties for visiting and stuff like that. And I said, you're right, but we haven't gotten our stuff in order yet to visit. They said, Mr. Cateau, here's the situation. Last year, the same time, we came to visit her for her 95th birthday. That's when the government literally shut down nursing homes. They could not visit with their mom that day, right? Blame the staff, but guess what? The staff were following the law. So they were turned back, could not visit with her. That was her 95th birthday. They said she's going to be 96 tomorrow, and we want to be there for it. So I say, no problem. I'll make it happen. So I called the building and say, hey, they're going to visit, so they're going to be our first ones. Of course, we have the screen for them to visit behind and stuff like that. So they come to the nursing home. We're prepared for them, but the staff was like, we got to keep the screen up. Deke, we got to be careful, whatever. Don't blame the staff. The staff are doing their job, because I see everyone like, no. The staff are following the law. They're doing their job. The staff member who brought them into the home, she had to go upstairs to help someone else. I pushed the screen aside and I said, hey, here's your chance. You hug her, you kiss her. Do a Zoom call, whatever you can, right? And they did. And they were extremely appreciated. Honestly, I was scared for the next 7 to 14 days. Because I'm like, if this lady gets COVID, what are they going to say? The CEO brought them in. Yeah, that's surplus of safety, right? Our staff are not wrong to be conditioned that way. They're not wrong. Because what did they do in the building that's not conditioned that way is facing those 3 IJs, facing, as of yesterday, $170,000 in fines, right? So that's been my couple months. My wife went to Ross or Marshall's or some store, and I was home sulking about how bad my world is, everything's going wrong. And she saw a painting, and she sent it to me, and I said, oh yeah, buy it. And this was the painting. A smooth sea never made a skilled sailor, right? So that's the times we're going through now. To my point earlier, we're going to come out of this on the strong side of it. Let's talk about our care partners. Let's talk about our staff. Bold statement. If you take care of your staff, they in turn will take care of your residents. These next 3 or 4 slides pretty much say the same thing, so bear with me as I go back and forward. But these are our staff. These are AG Rhodes true staff. These are our interviews with our staff. Leading Age actually published these interviews last November. They were in Atlanta in Centennial Park for the conference. Robin McFadden, these are our staff's words. I pray when I go into work for my spirit to treat people right. You know what I mean? Treat people the way they want to be treated. Randy McFadden, a buddy of mine. Randy, by the way, has been a CNA in our Atlanta community for 49 years. CNA for 49 years. I enjoy helping people. I always want to be able to help people. I had no idea what I was winding up in this field. But once I got involved in it, I fell in love with it. I always try to go the extra mile to help somebody. Along the way, I've met a lot of fascinated people, and I've had wonderful relationships with my elders. That's person-directed care right there, that whole statement. These are our staff. These are our care partners. I say that because if we do not realize how we need to treat these people and how we have not treated these people right over the years, me included, again, I'm recovering. I have not treated these individuals the right way. I have not allowed these people to live. You're going to see a little later the mantra of this industry that I grew up in this industry learning. The mantra is what? The resident is what? Always right. The resident is always right. Not sometimes right. That's the mantra. The resident is always right. Is that true? Right. No one is always right. No one. By saying that mantra, I understand why we say it. I totally understand why we say it, right? They're the consumer, right? They're the reason we are working here. I understand why, but it's a wrong statement. And by saying that year after year, decade after decade, what has that done to our staff? It makes the staff always wrong. Toughest part of my job has always been terminating people. I've terminated many, 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 many people. As I look back now, a good percentage of those people I've terminated, rarely is for the wrong reasons. It's because the resident was always right. And the easy thing to do when you have an issue is terminate the staff member. State's happy, family's real happy, everyone's happy. That was a wrong practice. We need to get that, we need to understand that. We need to realize our care partners, our staff, call them what you want, are as important as our residents are. As important. The Edenites in the room, Eden Golden Rule. Do unto the staff as you have them do unto the resident. Absolutely. That's the secret to good nursing home administration. Take care of your staff. Then you could go home and sleep and not get called every minute. Because when you're home sleeping, guess what? Staff are being taken care of. Our industry's changing. Another bold statement. We have to build the right team or right teams for what we're facing with now, what we're being faced with in this industry. For me, one of the most important roles in that team is your human resources role. The person who's doing your hiring, the person who's doing your staffing, the person who's advising you on terminating people. That is such a critical role. Those of you in this room who are providers, if your HR people aren't good, you need to really take a closer look at that, one. If your HR people are not reporting to you as the head of the organization, you need to take a close look. That should not be under operations. I'll say it plainly. HR should not go under operation. Your HR person, if they're not yet, mine is now my chief human resources officer for a reason. For them to realize how important that role is, and for them to come to me and understand that is our most important resource, is our human resources, our staff. So we need to look at that role very, very carefully. Another huge role, and I know this is a tricky one because not everyone can afford it, I'll say right out. But if we're going to change the perception of this industry, communications becomes extremely important. I'm not saying you got to go out and hire a communications officer. I do have one. But the messaging, what we put out there is we need to show the public the good things that does happen in nursing homes, right? My guy here, Nathan Jones, if you all don't know him, meet him real quick. Nathan does my social media, right? It's real important. Nathan puts these great images of what happens in our homes out there, and he reaches people exponentially by doing that. More than you and I could do in conferences, more than you and I could do by going to the grocery store and saying, hey, I got a really nice nursing home or assisted living community here. This is 2022. Instagram, Facebook, LinkedIn, I don't like it, but trust me, they reach people exponentially. That's how we change the image of this industry. So understand the importance of that. We could come to conferences and preach all day. To who? The choir. Right? The people who come to conferences typically get it. That's why they come in. Well, some come for credits, but in alternative, I would be completely wrong if I did not speak of how great an organization this is, similar to Pioneer Network, similar to the great folks at Greenhouse. Congratulations on the partnership. But I've learned a lot from the Eden Alternative over the years. I'm proud to serve on their board now. And the Eden Alternative is who gave me my aha moment. I was sharing with Walter, who actually taught the class in which I got my aha moment. I shared with him last night that it's not when people think I got the aha moment, and I didn't get it from the principals and all that great stuff. I got the aha moment when a CNA who was in my group at the end of the class stood up and she went on the board and she wrote all the great things she was going to do when she goes back to her nursing home. She said, I'm going to do training for all the CNAs. I'm going to come in and have them do this. I'm going to make sure they do that. And I'm like, you're going to get fired in my mind. Because you neither have the authority to do any of those things, you're not empowered to do any of those things, you don't have a budget to do any of those things, so you're going to go do them, but you're going to piss your coworkers off by doing it because your organization ain't ready for that yet. And you're going to get terminated. And that's when I knew as a leader, this movement needs leadership to get on board with it. So that when that CNA does come to do those things, he or she does not get terminated. All three of my communities are on the Eden Registry. I will say openly, we have taken maybe 15 steps backward because of COVID and not being able to reinforce those principles the way we had. Way backward. I'm kind of scared because we got to catch up. But I will also say that person-directed training through Eden, thank you, Jill. Jill actually is the person who guided my team through our Eden journey. And those lessons learned there is what actually got us through COVID. We would not have been able to get through COVID without those lessons. But since then, we've taken several steps backward. Eden talks a lot about the domains of well-being, and in preparing for this, again, we talk about the domains of well-being in relation to our residents. I want to challenge all of us in this room to think of these domains in relation to those who take care of our residents, our caregivers. Their identity, their work has to be a reflection of themselves and their values. Their connectedness, getting them locked into that sense of mission. Their security, pay them right. They need to be paid properly. Properly. That's their security. Their autonomy, giving them that ability to decision make, that choice making. Their meaning, their jobs have to have a sense of meaning. Professional growth, their opportunities for professional growth, which we're going to touch on. And of course, their joy, ensuring that their work is fulfilling. We touched on this already. Resident is always right. Are they always right? All right. Going to get a little controversial as we introduce the second or the 5 more? Okay, all right, real important. May take a bit more than 5 on this because this is so important. I say this boldly and plainly. Pioneer Network is better than most, but our industry does not look like our nation. Our industry is inherently classist. Some like me may claim inherently racist, inherently against people who look like me, people who sound like me. I want to show you all these realities. Over half of our CNAs are people of color in this nation, right? Immigration. A lot of bad stuff has happened since 2016 with immigration. This is a reality. Quarter of our workforce are immigrants. In my case in AG Rhodes, 40% of our staff are immigrants. Jennifer, this was for you. Absolutely, right? These are workforce realities. And since 2016, look what has happened with migration. Since 2016, which is in the middle there, right? It's not Trump's fault. Well, it was his to start, but it hasn't gotten any better under the new administration either. So this is not political. Both the present and the past government have done a horrible job with that. It's a big reason why we have staffing issues. COVID's a big reason here, but this is a huge reason why. Very proudly, 5 minutes left, I am proudly from Trinidad and Tobago. I am an immigrant. Who is now the CEO of a very well-run, very well-oiled organization. First person of color to lead that organization. Obviously the first immigrant to lead that organization. We had a great conversation, Jennifer, last night, and people don't get that it is extremely lonely for people who don't look like most people in this room. I'll say it again. It's extremely lonely, and we need to appreciate that and understand that. So when our staff are not themselves, when they're not expressing themselves the way we think they should, it's because it's lonely. I'm confident now. I'm confident to get up here and speak in front of hundreds of people if I need to. I was not always confident. I was lonely, I was scared, I would fumble my words, I would have to think too carefully before I say anything because of that. So if we don't understand, if we don't deal with that, if we don't realize that is such a critical part of our workforce development, we're not going to have staff 5, 6, 7, 8, 9, 10 years from now. Agencies are going to keep loving us. They're going to love this industry even more than they are already. And leadership development is very important. I have a video I'm going to show. I'm not going to show the video, but I'll trust that Penny will send it out. We'll try to get it out to folks. But it is so important. It's a leadership development program. We just finished our first year of it. It's highly not just academic, but it's real, and it's preparing our staff for the next level. We are a small organization. These are the 5 first graduates, and we have 5 more in the cohort this year. We're probably going to lose most of them. We've already been able to promote one of them to a senior management position. I mean, people from CNAs that have been able to be promoted to those levels. Because we're so small, we're probably going to lose some of them. But I'm proud of it. Because even in losing them, guess what? They're going to develop themselves professionally and otherwise. And this program targets minorities. Anyone could get into it, but We are really trying to get people who do not have those opportunities to get into those opportunities. Before I introduce someone who's going to come up on the stage here with me, he's a great friend. He's very like-minded. If I knew he was going to wear a white suit today, I would probably have worn a white suit too. But this slide is actually the first time I met him was in 2020. This slide is his product. And it's a reality. It says Leading Age. We both serve on the Leading Age National Board. This is the top 200 leading age organizations based on revenue. Fortinet, my organization, is one of them in the top 200. In 2020, had 3 of those top 200 leaders, CEOs like myself, for people of color. That real black one down there is me. Right? The green in between are the females, minority as well, understand that. Right? If I talk to my friends here from the lesbian, gay community, it'd probably be none. Right? We have issues with the isms and we need to realize it. This industry, we love to fight ageism, right? Ageism, ableism, ageism, ableism, ageism, ableism, ageism, ableism. What about racism? What about sexism? What about what about ism based on people's sexual orientation? Right? Let's not just culture change, right? Culture change, ageism. There are a lot of other isms. Without any further ado, did I do good in that 5 minutes?